Hello everyone and welcome back to my channel. So in today's topic, I'll be giving you some hints about the different types of family planning. You know, after you have put to birth, or if you're planning to have babies at a particular period and you are married, or maybe you are living with your spouse, you need to know what are the different types of family planning and which one to choose best depending on your decision. Maybe you want to wait maybe for some months, or maybe you want to wait for like 1 or 2 years, or maybe for a longer period. I'll be telling you some of the different kind of choice you can easily check from. So stay tuned. If this is your first time watching me, don't forget to like, subscribe, and also share this video. It might equally help someone in need out there. So stay tuned. Hello everyone, welcome back. So like I already said at the beginning of this video, we'll be talking about the different kinds of family planning method. The first I'll be talking about is the use of condom. This one many people they already know, but how effective is it? That's the problem now. So the disadvantage with condom is that at times the thing might tear, at times it might burst, at times it might slip out, and definitely you are going to get pregnant. So this one is not really effective. At times it might not even be there when you want to do your things. So it's still kind of not 100% because of all of this limitation. So but for the condom, it's very effective in the fact that it's going to prevent you from sexual transmitted infection. That's the highest it can do. It's really working on that method. But as compared to the other type of family planning method, you have to still protect yourself from STIs. So if you are using a condom, it will help prevent you from getting sexual transmitted infection. But with the other ones, they are not going to help prevent that for you. So the second method I'll be talking about is the use of spermicide, use of cervical cap, use of cervical diaphragm. Those ones you insert it inside the vagina and it blocks the cervix. So blocking the cervix, it's going to prevent sperm from passing through the cervix and going up to meet the egg for fertilization. But this one at times come with its own kind of disadvantage, because if that cap you are placing it inside the cervix area, if it's not well kept there, or if you don't put it correctly, it's going to create a passage for sperm to pass through, and definitely it's not going to work effectively like you want. And for some people, they kind of find it uncomfortable when they are inserting the cap. So if you can insert it correctly and you find it very comfortable, that is also a good method of family planning. For some people, they are going to use the cap, cervical device, or maybe the diaphragm, or maybe the sponge method with spermicide. So they are going to use these other devices with spermicide. Spermicide is just going to kill the sperms or make the sperm less active, so that they will not be able to move through and reach the ovary. In case, let me say, the diaphragm or maybe the cervical cap that was placed in the cervix was not well placed there. So the spermicide is also going to kill them. So even if they pass through, they will not be that effective and they will not be able to fertilize the egg in the ovary. So this method is another means of family planning. So the next method I'll be telling you is the emergency contraceptive pills. This one is being consumed by many youths and also by many adults out there. So with this emergency contraceptive pills, you only use this method of family planning when you were not certain, like it's an emergency contraceptive pills. So it's being used in the case of an emergency, like you did the deed and you were not prepared, or maybe you used a condom and the thing burst out and sperm went out. So in that situation, what you have to do is that you have to run to the pharmacy and you get an emergency contraceptive pills. This pills is not something that is supposed to be at the cupboard of your bedside, because it's an emergency. So you only take it when you have some unforeseen situation. That is why it's known as an emergency contraceptive pills. It's very effective, but this pill has to be taken within an interval of 73 hours. So the earlier you take it, the more effective it's going to work. If you delay and you take it late, the less effective it's going to work. Okay, so the next I'll be talking about is the injectable contraceptive pills. They are of different brand. You have, for example, the Depo-Provera. So this one is very effective. You go to the hospital and the doctor is going to inject it on you, and it lasts for a duration of 3 months. So every 3 months you have to go and get the dose. So it would depend on the kind of family planning method you want. So you can go to the hospital and the doctor will tell you which one is best for you. For this Depo-Provera, some people, they kind of give feedback regarding it that after they have stopped taking the Depo-Provera, they find it difficult for their menstrual flow to return back to normal. At times they are going to stay maybe for 3 months, maybe for 6 months before they will have their menstrual period. So I will advise you to always visit the doctor and talk with the doctor before choosing the best kind of family planning method you really want to go for. Okay, so don't just jump into any kind of family planning because maybe you heard someone saying this is what they are using or this is what they have used. But definitely the injectable contraceptive pills is very effective, but you have to visit the doctor every after 3 months for it to be injected. And at times also some people will tell you they have pain, they have maybe heavy bleeding and many other stuff. So that is it, but definitely it's very effective. And the most important one I'll be talking about is the intrauterine device. So this one is just like a T-shaped structure. You insert it inside the vagina and it's going to help prevent you from getting pregnant. You can also use this one as an emergency contraceptive pills for a duration for 5 days. Like let me say you had sexual intercourse and unfortunately you were unable to have the emergency contraceptive pill. For example, let me say you had contact with your spouse or maybe with your partner and you were unable to get the prostanol, which is the emergency pill. You can also use the intrauterine device, but this is effective for a duration of 5 days. Even if you had contact with your spouse and you never did nothing for a duration of 5 days, you can use this one as an emergency contraceptive pills. And this one is very effective because it can last for a longer duration of time. Like let me say for example, you don't want to have kids maybe for a duration of 5 years, you can use this because this equally lasts for a duration of 5 to 10 years and it's very effective. But one thing you have to keep in mind is that every month you have to make sure the string that is coming out from your vagina has to be there. If in case you don't find the string, you have to go to the hospital immediately for the doctor to check on you, because there are times in which the string can get cut, and when it gets cut, the T-shaped structure is going to try to move into your fallopian tube. So with that kind of a situation, you need to visit the doctor and it needs to be taken out. And other people will find some abnormalities immediately after this structure has been inserted in them. Maybe they'll have heavy bleeding, but after some time it's going to subside. So it's very effective also, and the best part is that it can last for a duration of 5 years. But if you want to take it out before the 5 years elapses, you can equally do that. So it's very effective, and this one I think it's more comfortable as compared to the other method. There is another one also that they call this one the implant. It's just like a small metal rod. You can implant it. Most of the times people will implant it on their arm, bury it on their arm, or maybe on other body part. So this one also is very effective. Once it's buried there, it's going to release hormone that will alter your ovulation, and once your ovulation has been altered, it's also going to prevent you from getting pregnant. So these are the different methods, normal family planning methods we can always use all the time, and they are very effective. But like I said already, always visit your doctor, so your doctor will check on you. What can be good for Madam Neba might not be good for Madam Cynthia. So definitely go to the hospital and check, so the doctor will give you the best that you need, and depending also on the length in which you want to stay without having a baby. And the very last that I'm going to talk about is for both the male and the female. The very last option is the bilateral tubal method. So with this method, like for example, you have choose not to have babies, like you don't want to have babies again, you can go to the hospital and the doctor is going to clamp your fallopian tube, or maybe completely cut off your fallopian tube. So there is no way the egg can ever be released, and there is no way you can ever get pregnant. If your egg cannot be released from your ovary, definitely you cannot get pregnant. Or if the eggs are released from the ovary and they cannot come into the fallopian tube for the sperm to come and fertilize the egg there, definitely you will not get pregnant. So with this method, it prevents the sperm from ever reaching the egg, so definitely you cannot get pregnant. So at times this method can be permanent for life, you can never have a baby for life. Or at times, if it's only clamp, after some time the doctor can release the clamp and you can equally get pregnant. And it goes wise also for the men. For the men, they can do this procedure which is known as vasectomy. So with this procedure, what it does is that you go to the hospital. It's a very minor surgical procedure, so no need for you to be scared. It's a very minor surgical procedure. You go to the hospital and the doctor is going to cut the tube that carries semen. So once that tube is being cut, there is no way you as a man can equally fertilize a lady. Some of these men that you are married to, at times you might be saying like, I've been struggling to have a child. Maybe your husband has equally done a vasectomy. I'm just saying, I'm not saying that maybe that's the reason why you don't have a child, but some men secretly they will go behind and do a vasectomy. So no matter how you try, you cannot get pregnant. But for this vasectomy also, it's now reversible. So if you want to change it, after some time you can go to the hospital and the doctor will still do a minor surgical procedure and connect the tube back together. So definitely you can equally impregnate a woman. And also for this vasectomy, there is one thing: once the tube has been cut, you still need to do abstinence for a period of I think it's 3 months, because within that time when the tube has just been cut, you can equally still get a woman pregnant. So but after a period of I think 60 days, or is it 3 months, definitely you cannot get a woman pregnant anymore. So that is it. So these are the different methods of family planning you can equally choose on. So you have to go for the one that best suits you better. And there are many other methods out there. You have, like, for example, the patch method. For the patch method, it's just a patch that you apply it on your skin. You can put on your tummy, you can put on your butt, you can put anywhere, you can put on your arm, any part that is comfortable for you. So for the patch method, I think you put for a duration, each week you put one patch. So you put for 3 weeks consecutively, and the last week you don't put any patch. So in a month, that is 4 weeks, you put the patch 3 times. And just go to the hospital, check with your doctor, and your doctor is definitely going to tell you which method is the best for you for family planning. So don't just be hopping around thinking you can just do abstinence and it's going to work for you. Abstinence can work, but the issue is that, can you really do abstinence? Abstinence is also the best and the safest method, but the issue is that, can you do abstinence? So if you cannot definitely go on abstinence, you can choose any of this family planning method. But most importantly, like I said, before you want to embark on any of this family planning method, kindly check with your doctor, because as well as they have their advantage, they also have their disadvantage. And also, what can be good for another person might not be good for you. So don't just embark on it without getting proper diagnosis from your doctor. Okay, so stay tuned, and I love you all. Don't forget to like and also share this video. It's very important. It might equally help a mother out there, or maybe a young lady out there who is trying to choose with what kind of contraceptive method or what kind of family planning method they have to choose on. So kindly share the video, and don't forget to like, subscribe, and turn on your notification bell, so if I drop a new video, definitely you will always be the first to see. So stay tuned, and I love you all. Ciao.